Thanks everyone for joining the sixth installment of this webinar. Rebuilding Alliance is honored to be co-sponsoring this series alongside the International Society for Social Pediatrics and Child Health. Last week, Tuesday, November 5th, the World Health Organization, along with UNICEF, UNRWA, and local partners in Gaza, concluded the second round of the polio vaccine rollout in Gaza. This second round follows the first and represents a significant cessation, a significant pause since the war in Gaza began 403 days ago. And despite many challenges, they were able to reach their target goals in the first two phases, so in the south and in central Gaza, but they did have to pause administration of the vaccine in the north because of the intensity of bombardment from the Israeli military. They did eventually administer vaccines in the north, but it was incomplete. So we're hearing that Beit Lahiya, Beit Hanoun, and Jabaliya had areas where people were not vaccinated. So to speak more on this, we're really honored to have Dr. Tsega of UNICEF and Dr. Akbar from the WHO to summarize and assess how the second round went. And we look forward to discussing how to ensure that the children in the north do eventually get vaccinated. Rebuilding Alliance continues to serve meals in Gaza, and here to speak on this and more, we have Donna Baranski-Walker, the founder and executive director of Rebuilding Alliance, joining us from Jordan. Donna?
Hello, everyone. I'll just briefly go over some of the things that Rebuilding Alliance is experiencing on the ground. And I wanted to also update everyone that we've completed our 9th leadership learning mission, bringing congressional staff from both House and Senate here to Jordan, where I am right now, also to the West Bank and to Jerusalem. And we were honored to meet with the World Health Organization, with the World Food Program, with dignitaries, diplomats at the U.S. embassies in Amman, in Jerusalem, and the embassy annex in Tel Aviv, also with many officials at various levels and many human rights groups. We also took them to Palestinian villages and met with Israeli communities and Israeli human rights groups as well. It was an intense trip. It provided a lot of access. It raised many questions and offered considerable insight. As a result, we continue to press forward. Inside of Gaza, Rebuilding Alliance continues its 21 kitchens and is serving close to 60,000 meals per day. That's become extremely difficult. Although maybe in the last 24 hours, we're seeing a little bit of change in that food is arriving, not a lot. Kitchens around us have been closing, and that's in the middle section of Gaza. In the north, in the very north, there's the almost complete blockade and constant bombing in Beit Lahiya, in Beit Hanoun, and in Jabaliya. But 2 trucks of food reached Beit Hanoun. The bombing continues. It is intense. I've been staying with a Beit Lahiya family in exile, and it's almost, well, it is heartbreaking to watch because the news on the television is of people that they know who've lost their lives, who've been killed, and the calls are coming for condolences at the same time. I bring that forward because this is changeable and it matters, and what people do on this call, calling Congress, emailing, using our link on Action Network, that can all help. I wanted to ask the participants, and we'll go back to you in a second, Nisreen, can we record this call? What's your feeling, doctors from UNICEF, WHO, and from ISSOP? Can you give me a yes or no on that? Yes?
Yes.
Go ahead. I know a lot of people are very keenly interested in what just took place with the polio vaccine program, and really an incredible thing to be able to do medical truces as you've done. So certainly appreciate it if we can go ahead. So I'm not hearing a strong no. So please, Nisreen, go ahead and record the call and back to you.
It is being recorded.
Great, thank you.
Yeah, thank you so much, Donna. To set the stage for us, we have Dr. Jeff Goldhagen, the president of the International Society for Social Pediatrics and Child Health, who will discuss the critical importance of the polio vaccine globally and the important role that physicians, pediatricians, and child health professionals can play in addressing these types of global challenges in child health. Dr. Jeff.
Well, thank you, Nisreen, and thank you, Donna, and in particular, thank you, Dr. Tsega and Akbar, for what you're doing and for what your organizations are doing, in particular as it relates to Gaza, but in general as it relates to Gaza, Sudan, Democratic Republic of the Congo, Yemen, Armenia, Syria, and so on and so forth. So this is a critical period of time in the context of the history of public health or recent history of public health. There's never been a time, as far as I know, where there have been so many children impacted by conflict. The estimates now are that around 20% of all children around the world are either immersed in or impacted by armed conflict. That's over 500 million children globally. So the issues that we're addressing in Gaza are the tip of the iceberg and a reflection, and maybe in a clinical way, a case study of the challenges that we will be facing. The world was successful with smallpox. We have come in the past pretty close to eradicating polio. And now, because of the conflicts that are happening around the world, we are being challenged in ways that we've not been challenged in the past. What we've learned over the last certainly 4 or 5 years is that there is no such thing as a contained pandemic or a contained viral epidemic, whether it's COVID, whether it's H1N1, whether it's Zika, and so on and so forth. Viral epidemics are global epidemics, and so all of us are at risk. So what happens in Gaza is critically important to what happens in the region around Gaza, but as we've spoken about in the past, also very relevant to Europe, to England, to the United States in particular. We know that in 2022, we had a polio case in New York, north of New York City. We identified circulating poliovirus in the sewage systems in several counties. And so that's a reflection of what we know polio to be, which is a highly, highly infectious viral illness that particularly has an impact on vulnerable children. So what happens in Gaza and what happens in other places around the world where there are armed conflict is relevant to the world and not just to those isolated regions. But for organizations like WHO and UNICEF and organizations like Rebuilding Alliance and so on, we would be in far worse situation globally than we are now. And it would be, how can I say it? It would not be appropriate to disregard the political environment in which we are descending, not just the issues, and hopefully we'll have some time to talk about them at the end, not just the election in the United States, which will continue to result in the dismantling of public health systems in the US, but also the impact on the financing of WHO and also other countries around the world that are moving rightward into nationalist and populist environments. So we not only have the political issues that we're dealing with, we have the conflicts we're dealing with, but we also have the challenge of mobilizing the world to understand how important these issues are. So without any further ado, allow me to have Dr. Tsega and Dr. Akbar present, and then we will have the opportunity to talk about what this all means, what we can do as a community in particular of pediatricians and child health professionals. I'm fond of saying that no profession will bear witness to the impact of epidemics, and in particular polio, on children more so than pediatricians and child health professionals, and thus no profession has more responsibility to respond. And so that's really what we're going to be talking about today. So thank you for joining us. Thank you again, Dr. Tsega and Akbar, for your work and for the work of UNICEF and WHO and your colleagues in addressing these critical issues. Nisreen?
Thank you so much, Dr. Goldhagen. Now, to speak with us on how the second round of the polio vaccine rollout in Gaza went, we're honored to have with us Dr. Tsega, UNICEF's regional polio coordinator at the Middle East and North Africa Regional Office in Amman, Jordan. Dr. Tsega is also a medical doctor with a Master of Public Health from Addis Ababa University in Ethiopia and has more than 30 years of public health experience. Dr. Tsega?
Yeah, thank you so much. I hope you can hear me clear. Nisreen, can you hear me?
Yes, sounds good.
Yes. Thank you so much. Yeah, as part of introduction, myself and Dr. Irfan Akbar, we coordinate a team of outbreak response team in the region. Myself from UNICEF and Irfan from WHO. Therefore, what we are doing and the content may be more or less the same because we are doing the same work. And what I'm going to present is not only UNICEF, but WHO, UNICEF, and all other partners did. Therefore, it is not only UNICEF, even though the presenter is from UNICEF. I hope Irfan will supplement in any of the slides when you think is appropriate. Therefore, I will go through a few slides and then will be available also for discussion. Good morning, good afternoon, everyone. And as introduced, I will go through the slides. Okay, this is the topic is stopping polio in Gaza for us all, and introduction have been given on polio situation in Gaza and also other humanitarian situations. This slide is to show you globally the polio situation now. As you know, polio is almost to the end from where started in 1988. Only 2 countries remained with wild polio virus. These are Afghanistan and Pakistan. This year, Afghanistan has only 23 cases, wild polio virus, and Pakistan 48 cases up to now. But these are the only 2 countries remain with wild polio virus. But unfortunately, another type of virus related to the vaccine called variant type of virus is appearing now in many countries. If you see mostly in Africa and the Middle East, you see these green dots are the circulating vaccine-derived type 2 mainly, but in some countries are also type 1. Therefore, up to now, about 41 countries have been affected with this one, and type 2 mainly 205 cases, and overall 218 cases. Therefore, the main really effort now is to stop this one in addition to the wild polio virus. And what myself and Irfan doing is in this Middle East and North Africa region to stop this circulating vaccine-derived poliovirus transmission. In the region, which is IMRO region, or in the UNICEF, we call it Middle East and North Africa region. These are the countries currently reporting cases: Algeria from North Africa, Egypt, and in the Middle East, also Gaza. Of course, Yemen is a major problem, has this year has reached up to 35 cases, but in the previous years reported a lot of cases, and Sudan has also reported. Therefore, these are the cases, and most of these cases have been imported from other countries. For example, the Algeria case is from Nigeria down because there is huge outbreak in Nigeria, and Egypt also received a number of importations through Chad and Sudan from Nigeria, and also from Yemen. Therefore, these are the countries. Of course, Somalia is also in Emro region, that is also one of the countries affected. Then when it comes to Gaza, the situation started, I mean, as it was presented at the beginning, Gaza has been in a very difficult situation. The population have been suffering really since October 7, 2023. But for polio, the situation started on 23rd of June 2024, when 7 samples were collected from 2 sites from Khan Yunus and Dar al-Balah. And on the 16th of July, these samples were positive, were found to be positive in a global polio network lab, accredited lab, and that is where the situation started. And further analysis shows this linked to the viruses in Egypt, which was circulating before. And after that, the surveillance was really revived, and a 10-month-old child was also become positive. He developed paralysis and become positive. And then also 5 more environmental samples. Based on this, the Ministry of Health declared this as Gaza as polio outbreak. On the right side, you see the maps where the first samples were collected. Then after that, the risk is, as it was said, polio is a very transmissible disease, and importation from one country to the other is very high. There was one time importation from Karachi in Pakistan to Malawi. Therefore, even though geographic distance is very far, but virus pass where people travel. Therefore, the risk is this virus is not only for Gaza, but also to the surrounding countries, to Egypt back, to Lebanon, to Syria, to Jordan, to all the regional countries. That is why immediate action should be taken, and that is how we started all partners with Ministry of Health, mainly WHO and UNICEF. We started the outbreak response. Therefore, my slides will be on both rounds. It is not only for second round, but it will be on both rounds. Therefore, the preparation was started. We started the preparation immediately after the outbreak was declared. And UNICEF and WHO deployed team of experts to the area, and then after the assessment, cold chain equipments were procured and operational budget developed, and that was also transferred within short period. Additional international and experts were deployed, and locals also recruited. And high-level discussion also started with COGAT. This is for security arrangement, because it is a war situation. Therefore, discussion and arrangement with the Israeli authorities was really very necessary to do that. Okay. And these maps, 2 maps, you can see one on the right and the other on the left. Okay, sorry. You can see the one on the right shows the population distribution before the conflict. That majority of the population was on the north, and but the middle and the southern part were sparsely populated. But after the conflict, because people have been evacuated multiple times from the north, also from the central, most of the population now are in the central and to the southern part of the country. Therefore, the micro plan or the planning was prepared based on this, but the northern part was also included. Gaza City and North Gaza was also included. And these are the cold chain comments procured based on the assessment. 20 refrigerators were procured, 100 cold boxes, 800 vaccine carriers, 2 cold trucks, and also vaccine, 1.6 million doses of vaccine for both rounds was deployed, and this is the vaccine. It was not easy really to bring these vaccines because of limitations in the air transportation around that time, because the conflict became almost regional. Therefore, there were really a lot of challenges for UNICEF to bring this. Therefore, it was possible only to bring them with chartered flights. Otherwise, and a few days passed actually delayed because of these challenges in bringing these supplies. And the plan was to vaccinate. At the beginning, the target was different, because one of the challenges, people have moved different times. The actual target population it was difficult, but the last at the end, the target population is 591,714. This was revised later on, and the plan was to conduct 2 rounds based on the global polio eradication guideline. Round 1 was from 1 to 12 September, and round 2 from 14th October to 5 November. As Nisreen said, it was completed last week. Therefore, the cold chain comments mentioned above were deployed, and social and behavioral change and awareness activities were conducted by partners and Ministry of Health, and coordination also happened. And a flexible micro plan was developed, but it was really challenging because things were changing, people were being evacuated. Therefore, the micro planning had to be adapted again and again. This is to show you the social mobilization. Risk assessment was done at the beginning, and 83% of the population really understood the danger of the outbreak, and 94% of the respondents said they are willing to vaccinate their children, and 87% believe the vaccine is safe. And different social mobilization materials were used, posters were used, mobilizers were deployed, and messages, all the social media, including WhatsApp, Telegram, were used for the messages, and also radio and TV. And this card was also used for social mobilizers to go around to mobilize the community. The picture on the left side. This slide is to show you, as it was said before, the implementation of the first round on the left side. Sorry, and on the right side is the second round. For the first round, the dates were, as I said, from September 1 to 12. And the green areas are the southern part, phase 2. The middle orange was phase 1, and the northern part was the pink one. And all this were conducted more or less, despite difficulties in the north. I think the first round was good. During the second round, for the south and the middle part, it was the same. But the northern part, if you see the map here, it is not a full map like the first round, because of the limitations, and the conflict escalated in those areas, and it was not possible to cover some of the areas. Therefore, most probably, we don't have the exact number, 7,000 to 10,000 children under 10 might have been missed due to this area not covered, but it cannot be exact. This is what was estimated. Therefore, what is the coverage I am presenting for both round 1 and round 2? Actually, the campaign achieved very high coverage, starting from Dar al-Balah in the middle, and also Khan Yunus, and also Gaza city. Gaza for the first round was 94%, the second was 88%. When you compare it to the first round in Gaza city and North Gaza, about 6,700 children less than the previous round, but otherwise the other round is more or less compensated. the phase 1 and phase 2, that means the Dar al-Bala and Khan Yunis population, they almost overlap. Therefore, some population from Dar al-Bala were vaccinated in Khan Yunis and the opposite. Therefore, and with partners, independent partners, overall coverage, by the way, was 94% with the administrative data. But independent monitoring was done with WHO support by independent partners, and that coverage indicated 97 and 98% for both rounds. Therefore, this is the objective indicator. Therefore, we can say the campaign was successful. The finger marking was 73 and 78%. Still it is good for different reasons. Not all children had during the survey the fingers marked. Some children wash it immediately and so on, and some people say also it was not also properly applied also. What was surprising was because the population demand acceptance of the vaccination is very high. Therefore, if you see in all phases, the first day there was high population came to the vaccination site, and then second day and third day was a bit decreasing because most people came, especially in the phase 2 area. The first day, many people came, and it was really very hard for vaccination team because many people came than expected. This shows really their high acceptance. The same also in Gaza city. This happened in both rounds. Therefore, the demand for the vaccination was really very, very high. Okay, what are the challenges? I mean, the challenge is the conflict itself is a major challenge. People are moving from place to place due to evacuation, due to insecurities, and it was really challenging. And lack of experience doing similar campaign, especially for the first round, was a challenge. And the infrastructure, especially the infrastructure, has been really seriously affected, demolished. There are no health facilities. Even the cold room where we are storing the vaccine is a temporary cold room rented from a private person. Therefore, all these war-related challenges are really major challenges. And the health workers, the vaccinators, the mobilizers are very limited movement from one place to the other, and that also was a challenge. Okay, the conclusion, we can say that the campaign was really a very successful campaign. This happened because of high acceptance by the community and exceptional ownership and commitment of the Ministry of Health of Gaza, and extraordinary support from partners. This was really great from all partners. Supported this. Therefore, based on the WHO recommendation to conduct 2 successful rounds, I think for now, for this round, the two rounds were successful, and unless there is additional virus, there is no need to do for now any additional campaign. But I think what is the next step is the FP surveillance, which to detect if there are additional virus, both human and environmental has to continue. And of course, strengthening routine immunization is also very critical. Like partners are supporting on that one. And vaccinating those children who missed their routine immunization because of the conflict is also very important, and it is happening. For routine immunization, I have only one slide that all partners are supporting the routine immunization to continue for eligible children. And the data I have is to the second round. The coverage has been really, of course, before the conflict, Gaza had a history of high coverage, 99%, but now they managed to reach 89%, and the efforts are going on to expand the cold storage space, and all NGOs there who are providing health service also to continue doing routine immunization. This is my last slide. Thank you so much. Irfan, please come in to add. Back to you, Nisreen.
Thank you so much, Dr. Tsega. Let me see how to stop sharing screen.
Good.
I have a couple of questions maybe before we go on to our next speaker. Just clarifying questions. Dr. Tsega, what were the hours of the day for the medical truce? Because that is different from other medical truces. Perhaps you could just describe what that meant. How long did it last?
Yeah, thank you so much. You see, this was one of the challenges. We had a discussion actually. I was involved really in a initial discussion. Our expectation was to have the whole day, at least during those days, and the request was at least. Of course, our request is for a total ceasefire. For anybody's request is there should not be war in the first place. But to the minimum, we said that if they allow us the whole day to be, but it didn't happen. It was from 6 in the morning to 2 p.m. And therefore, we had 8 hours of opening to do this vaccination. Therefore, the vaccination team were really starting around 7 and to 8 and finish by 12:01 and so on. Therefore, the window period given was 8 hours per day for 3 days, and with the assessment in some areas, additional fourth day was added. Therefore, the hours of the day was very, very limited and restricted, unfortunately.
And did you find the truce held? Like, was it everyone was safe at least during those hours?
Yes, I mean, I don't remember any major incident happen, but there were some limitations in some areas. They could not travel in the days were supposed to travel. Therefore, for example, on the first day, in one of in the phase 2, people were not able to move. Therefore, but our senior managers were really regularly communicating with authorities there, and then they got permission. Otherwise, there were some limitations, especially to the periphery of the southern part and also the middle part. Of course, in the north was the most restrictive movement. During the second round, actually, one of our staff, we have only one staff permanently for UNICEF in the south, and she was saved really. Her car was hit by some form of firmament. I don't know what it is, but she was saved. Therefore, this is one incident I know. There were some incidents, I mean, people were not allowed to travel from the central part to the north, and they were returned. I remember that, but Irfan, if you remember anything more, but these are the two incidents I'm aware, but people have worked in a very difficult situation, but really it was really a good job they did despite the difficulties.
Yeah, it's an amazing job that they did. We heard of incidents, after the day ended, so at 2 o'clock going on, bombing would start, and that was pretty heartbreaking at times to hear about what would happen afterwards. But just an amazing effort. I'll have another question later, which is about how it spreads. Like, is there a danger? We've seen papers from doctors inside Israel about polio spreads. It can spread through the aquifers, but I'll bring that question later. Back to you, Nisreen, and please go ahead and introduce our next speaker.
Thanks. Thank you so much. We're also honored to have with us Dr. Irfan Akbar, the WHO's polio country support team leader, to provide an assessment of the recently completed second round of polio vaccination in Gaza and insights for next steps. Dr. Irfan?
Thank you, Nasreen, and thank you, Dr. Asnakew. I think I was about to present some of the operational details, but I'll skip a few slides, which probably Dr. Asnakew already talked about. I hope you can see the presentation. I have a single screen, so I don't know. Can you see the
Yes.
presentation?
We can.
Yeah, we
Okay.
can see it. Irfan.
Thank you. So just maybe background on the CVDP2 outbreak, Asnakew already talked about it. I will not go into that one, but the just additions which probably I could do is that in context and the risk field investigation and risk assessment noted high population density, deteriorating health infrastructure and daily displacements, presenting a high risk for CVDP transmission and international spread. I think already Asnakew talked about it. So as was said before that the GPI and the Global Polio Education Initiative, through ORPG approval, we conducted 2 rounds which are completed now. There were a lot of challenges. I'll come to that. And it was a phased approach, during both rounds. 3 phases were conducted, and of course, the second during the second round, the third phase got stuck, and we had to change the dates because, as was said before, that there was a lot of bombardment in North Gaza, and humanitarian pause for North Gaza was not granted. In terms of the measures which were placed promptly after the outbreak response, we had established the technical committee, which was for polio outbreak response, and it was comprised of senior representation from MOH, WHO, UNICEF, and UNRWA. This was supported by different working groups on polio SIAs and surveillance. Also, as Asnakew said, that surge support was promptly placed. There was also establishment of emergency operation center, which was established at WHO office in Deir al-Bala, which fostered involvement of MOH, WHO, UNICEF, and UNRWA in providing oversight to campaign operations and monitoring. Also, system for regular coordination with COGAT was established, and there were daily meetings with COGAT, and each and every step was discussed with them, and approvals were granted on daily basis, which was quite a laborsome job, but to implement the campaign, this was done regularly by the country team and partners. Communication, mobilization, and risk communication, I think Asnakew already talked about it. And the other thing which we started was the recovery of acute flaccid paralysis and environmental surveillance. The surveillance working group led by WHO Gaza in coordination with WHO MRO conducted a situation analysis and developed a plan for recovering and strengthening polio surveillance. If we look into the data, I think Asnakew already presented just broadly on in the second round, 556,000 children were vaccinated, which is around 94% of coverage of the administrative coverage. And truly, Gaza demonstrated resilient and consistent outreach in both campaign rounds, achieving remarkable results by reaching over 94% of target children amid intensified security challenges during the round 2. This is just a summary comparison. I think I will not go into the detail. Probably Asnakew already talked about it. So I'll skip this one and this slide as well. Just maybe something on the intra-campaign monitoring, which we have established. During the campaign, we have intra-campaign monitors who used to go and check how the campaign is going on. So the independent monitors and supervisors monitor a total of 407 teams during the round 2 and 273 vaccination centers. Out of the total teams checked during the campaign, about 16% were mobile teams. Female participation in teams was over 98%, which is quite encouraging. And also ICM helped in timely identification of issues in the field and fed EOC for corrective measures on time. In terms of post-campaign monitoring from round 2, on 13th October, training was conducted for 44 monitors and 6 supervisors from Amphinet to conduct PCM in Middle and South Gaza. A total of 212 clusters, 7 households per cluster were selected during round 2, and a total of 1,484 families were interviewed, where about 4,559 children were checked for vaccination based on recall of the parents and guardians. The recall-based coverage is as follows. The 0 to 11 months was 96%, 1 to 5 years was 96%, and 5 to 10 years was 97%. And if we see the post-campaign highlights from round 2 from other angles, additionally, 2,248 under 5 children were checked for finger mark. About 77 were found to have a finger mark. And as Asnakew said, there were some reasons not to have more finger marking, but enough finger markers were available and they were working properly. But maybe because of the technique, and some children cleaning their fingers very quickly, this result was a bit low. But for us, was the important was the recall history, which was quite encouraging. Almost all families were aware of the campaign, commonly from SMS, from polio staff, and social media. So there is a breakdown. I think you can see. I will not go into the details, but overall, not only the community response was brilliant, but also the social mobilization and the commitment from the MOH was there to bring out a lot of families and communities to the vaccination centers, and also they were presenting their children to the teams who were visiting at their doorstep, or maybe we cannot say doorstep, but wherever they were living. In summary, this is the round 2 cumulative coverage, less than 10%, 10 years, a total of 556,774 children are vaccinated. The key challenges, some of them were narrated by Asnakew, but just maybe a few additions to that is that there was no humanitarian pause for North Gaza, and because of that, we had to cover a lot of children in Gaza city. A lot of children came from North Gaza. They actually migrated, but some didn't migrate, and the figures already presented by Asnakew. Campaign quality in areas outside the humanitarian pause remained unknown largely, though we are, from the monitors who could visit those areas, the results were good, but in some areas where the monitor could not go, so still we are not very much confident on the coverage outside the polygon areas. Polygon means that the areas where the humanitarian pause was granted. Security incidents interrupted campaign schedules and limited fixed site operations in high risk areas. Like for example, on day 1 of phase 3 in round 2, there was a bomb blast at Al Sheikh Redwan PHCC, in which some of our staff and also 4 children were injured. Gaps in training for new field staff due to immediate needs, creating minor quality issues, and also sporadic social mobilization barriers affect consistent turnout in some areas. Now I'll talk about the key surveillance updates. On AFP surveillance, 2 more AFP cases are recently reported, raising the total count to 10. Out of these 10, the results from 8 are available, in which one was a positive case, a child of 10 months old from Khan Yunis. The child was, the test was done after the initial isolation of the virus, so the campaign was not implemented at that time. The stool samples.
Break in for just one quick question. AFP, what does it stand for?
Acute flaccid paralysis. So all the children who have any weakness in any part of the body that are reported as acute flaccid paralysis from the system, and then we test their stool samples to know that whether there is poliovirus in it or not. So AFP stands for acute flaccid paralysis. So
Akbar,
the
could I ask you just one quick question related to that? So the epidemiology of polio, acute flaccid paralysis, for every case of acute flaccid paralysis, there are multiple cases of children, of individuals who have the disease, but actually not resulting in paralysis. Is that correct?
Yes, that is correct. And normally, what we see is that 1 to 2% of the children who has a virus, they would be paralyzed. So it's kind of a tip of the iceberg. But regardless of the polio virus, if a child is suffering of any disease, may it be Guillain-Barré syndrome, transverse myelitis, or anything, those all come under AFP definition, and they are reported, and then we test their samples for checking that whether there is poliovirus in it or not. And based on that, the virological definition is then we call it as a polio case.
And so if it's 2% of cases actually result in acute paralysis, then we're talking 500 or more people who are actually infected with the disease.
Yeah, so I mean it's kind of a blessing in disguise as well. If polio was supposed to affect all children, then there will be huge number of paralytic cases. So in a large number of polio transmission, a large number of children, they are asymptomatic. More than 95% they are asymptomatic. 5% are symptomatic, in which from mild symptoms to the paralysis, these symptoms are there, and then less than almost up to 2% there is chances of paralysis. I hope that is clear.
Yes, that's important for folks to know, that what you said, that this is just the tip of the iceberg with respect to the actual existence of the disease and potential for spreading the disease.
Yes, you are right. So in terms of this environmental surveillance, result from 5 independent ES samples collected on 5th September are available from both Israeli and Jordan polio laboratories. All the samples which were collected on 5th September, they are positive for NOPV2, which emerged from Egypt, NOR1. The nucleotide difference is ranging from 13 to 24. This will become a bit technical, but I will not go in this detail. 4 environmental samples have already been collected from 4 sites, collected independently from Israel and Jordan labs. The samples reached Jerusalem on 6 November, and these samples also reached day before yesterday to Jordan. Additionally, 4 more ES samples were collected on 4th November from sites mentioned above. All environmental samples, total 8 collected independently for Israel and Jordan labs, have reached polio labs in Jordan day before yesterday. In terms of surveillance recovery and strengthening efforts, MOH nominated 5 rapid response teams for prompt AFP response and active surveillance visits. AFP surveillance network expansion and prioritization is ongoing. WHO Gaza sensitized key health staff on AFP surveillance and related protocols. Capacity building training of WHO Gaza staff on polio surveillance is completed, and expanded ES surveillance sites to a total of 7 sites. 4 are currently operational. In the next steps, some are mentioned by Asnakew, as was the first one, greater focus on polio surveillance now. We will also update the risk assessment, particularly following the lab results of the pending samples, and also we'll do a risk assessment for West Bank. We are starting weekly coordination between the IMST and IMST's incident management support team, which Asnakew and myself are co-chairing, and also with the WHO and UNICEF country offices. So we would be starting those meetings just now. Monitoring mop-up with the oversight of technical committee would be carried on. We still are doing some mop-up in the Gaza city. We have kept 4 teams in 4 health facilities, just to capture some of the children who are coming from North Gaza. Also, as Asnakew said, as a team, we will be working on strengthening routine immunization and VPD surveillance, including in West Bank. Sorry for some, sharing information again, but I didn't know that Asnakew would be presenting. So sorry for that. Just let me congratulate not only the teams, but I think the big, the appreciation goes for the community, like the way they responded, and they were bringing their children to these fixed centers, and the teams who are visiting their houses. I think we have not seen this example anywhere else during this war situation. How the families were responding, I think that was something to cherish. So just wanted to share that, and back to you, Nasreen, sorry.
Well, let me thank you profusely for the work that you've done. I think now, to a certain extent, there's a saying, if a tree falls in the forest and nobody's there to see it, did it really fall? And so the work that you've done in Gaza, which is a reflection of the work you've done in Yemen and Syria and the DRC and so on and so forth. I think the challenge right now is to make sure that it's a tree that falls that the world sees and knows. And so to a great extent, I think talking as a pediatrician, talking as the president of ISSOP, talking as the head of humanitarian crisis committee of the IPA, and so on and so forth, that really our job right now is critically important to make sure that, in fact, the world knows what you've accomplished and how you've accomplished it, because there's, as I mentioned, there's a risk that, in fact, there will be less funding, less support, and less understanding of really how critically important UNICEF and WHO and the work that you've done. So I can say honestly that I've not seen a better presentation of this work than the two of you have presented to us. And now it's our job to make sure the world, at least the world of pediatricians and child health professionals, see and understand and use their support and their advocacy to advocate for ongoing support for WHO, UNICEF, and the work that you've done. So there may be 30 or 40 people on this seminar and this webinar, but rest assured that we'll make sure thousands and thousands of our colleagues actually see this presentation, understand what you've done, and are prepared to advocate and support. Because as we know, as I mentioned, there are 500 million children at risk who are involved in directly or indirectly armed conflict, and the world of children in particular are at risk for the spread of polio. So thank you profusely for what you folks have been able to do, and the people on the ground who are the neglected or forgotten heroes of what's been accomplished, and they can't be thanked enough. So thank you. Dr. Akbar, do you have your hand up?
Yeah, thank you for all the kind words, and I think it was a team response, I would say, and especially as I mentioned that the community response was amazing. Just I wanted to mention one thing which I forgot to mention before, is that in response to Gaza outbreak, we also prepared a regional response, in which probably what Asnakew presented is that some of the neighboring countries are at risk. So we are also responding in those countries. We are strengthening the surveillance there. We have done some pose exercises there. So like preparation for an outbreak, polio outbreak, that has been carried out. In Jordan, it is completed. In some other countries we have done, and some are in line that we are doing. So we also would be maybe asking donors and partners to support this. So because there is a broader regional response to this outbreak, since we came to know about this outbreak in Gaza a bit late. So we think that maybe already it has crossed into some other areas. So we really need to strengthen surveillance and our response capacities in the neighboring countries. I just wanted to add that. Back to you.
Let me bring my question up about how it spreads. So I know it's an oral fecal conveyance, but is it possible that it goes into aquifers? Is it something that one should pay attention to from that point of view? And then also, just if it's oral fecal, then it must go on soil on tires, on boots. That would bring Lebanon to a forefront. Are you planning to do vaccinations? Do you have to see an outbreak before you vaccinate, or can you vaccinate based on your statistics and the possibility of it spreading?
Donna, actually, it's fecal oral, but you got close.
Oh, good. Yes.
Yeah, thank you, Dr. Goldhagen, for correction. Yeah, I think let me answer the last question first. Is that we do risk assessment even if there is a virus isolated. So we do a risk assessment, and we see that whether there is a chance for spreading, and then we do the response. Right now, the vaccine availability at the global level is not such that we have the liberty to do protective campaigns, and also the shrinking funds with the GPI will not allow us. But of course, what we can do is that to strengthen our surveillance activities and to pick the virus as soon as it comes, so to give us chance to respond quickly. In terms of how it spreads, as it is a fecal route, and it can be spread by adults as well. If the virus is ingested by a human through any source, and he or she can spread it. So adults could also play a role in spreading the virus. The route is and wherever we have a cross-border movement, there are high chances of spreading from one places to the other. And if we take the example of this virus crossing into Gaza from North Sinai at the time when probably there were a lot of restrictions. So it is very tricky virus, and it can with small movement it can still affect the population or the vulnerable population. I hope this answers the question. I think Asnakew wants to add.
And does it move in water in an aquifer?
It can, but it depends on if there is a mixing of wastewater with clean water, it can.
Dr. Tsega?
Yeah, thank you. I want to comment on certain areas. On AFP and polio, Dr. Goldberg, as Irfan said, AFP is an umbrella, and polio is one of the diseases which causes acute flaccid paralysis. And the surveillance system is very sensitive, but not specific. But one of the challenges I saw in some countries is doctors are expected to collect sample from every AFP case, from all flaccid paralysis case. But sometimes doctors said that, I'm sure this is not polio, therefore I don't want to collect sample. And we're missing some cases. Therefore, I think the message to all doctors is even though you are expert, you may know that that case not likely polio, but it is better to collect sample and the lab tell us that whether it is polio or not, because I heard a number of places that I'm sure this is not polio, therefore I don't need to send a sample, but it is very critical, really, this very sensitive but not specific surveillance system to be followed. That is the first one. There was a question, by the way, by the anonymous person who provided vaccine. The vaccine, the NOPV2 vaccine, which we used, is not available in the market, by the way. It is available it was only one supplier, now the second supplier, and it is approved only by WHO Director General. Therefore, it was provided by the GPI, and it is available only with GPI. It's called novel oral polio vaccine. This was the vaccine used. Therefore, no one provided nor donated. Partners or countries can donate money, but not the vaccine directly, because the vaccine is only one source and it is managed by WHO. Therefore, I think this should be clear. The other is on Lebanon.
I remember that you were discussing this before it arrived, that it was being produced in Indonesia, wasn't it? That was where it was
Now India
manufactured.
is also, now a second manufacturer in India is also producing from the same source. Therefore, these are the two sources, and it is centrally managed. It is not available in the market, and it is only for the outbreak response. It cannot be used for routine immunization or any vaccination. Therefore, this should be clear. The other thing is about Lebanon. Lebanon was repeatedly mentioned. Lebanon, I was told today they started vaccinating polio for their high-risk group using IPV, the IPV vaccine, which is globally being given. They started, I think, vaccinating today. That was what I was told in the office, because there is high risk. As Irfan said, there is only limited resource of this vaccine, and there is indication to use the NOPV2 vaccine, but it is really good that they are using IPV, which covers all the three types of polio. Therefore, I have this information that they are doing. Over to you.
Thank you.
Are there any other questions if people can put their questions into the Q&A area at this point in time? It appears that there aren't. Donna, do you want to finish us up here?
I do want to say that thank you again for this amazing work, and it was brave of everyone in participating in the way that it came about, and in the family's willingness to participate as well. What I hope is that the world continues to help you reach the children who haven't been reached yet. That leaving them without the vaccine puts them at risk. It continues to put their neighborhood and the region at risk as well. So I think it's still very important that I think you're quoting 7,000 to 10,000 children in Beit Lahiya, Beit Hanoun, Jabaliya area, that northern Gaza area, that they not be left behind. We'll do our best to advocate to make that happen, and certainly ask everyone who's listening to the call to urge Congress to intervene, personally. It's for the safety of everyone. Thank you again. Jeff, go ahead with your wrap up as well, and maybe closing statements from our doctor guests as well.
Well, I'm not sure I have anything more profound to say than I already, my comments. Again, this is a very vulnerable period of time for us all, for WHO, for UNICEF. One of the things that Rebuilding Alliance did and has done is meet with multiple legislators about the importance of the polio vaccine campaign, about a humanitarian pause. The challenge in front of us now is to meet with those same folks and others to ensure that, in fact, there's continuing funding for WHO and the tremendous work that you're doing. Short of that, then, as you said, one of you had mentioned that there's need for ongoing funding from global funding, and I think that's a role that civil society and NGOs can play to ensure that, in fact, there is continuing funding, expanded funding to help support your work. So that's certainly a commitment that we can make. That certainly I can make on behalf of pediatricians and pediatric organizations around the world. And all we can do is, at this point, is thank you for the tremendous work that you've done and the tremendous work that Rebuilding Alliance is in fact doing. So, Donna, let me allow you the last words.
Maybe just let me go back to the doctors. Dr. Tsega, do you want to make a closing statement from your experience and point of view?
Yeah, thank you for the opportunity. Really, the Gaza outbreak response was the effort of everybody. I mean, the advocacy role was very significant to have, even though it is very limited, to have the humanitarian post and to do this. I think the message for me from this polio, somebody told me that this was the only opportunity, the only post since October 7th. Therefore, I think this is really a lesson that if we push, there may be other opportunities also to do other. There are many other needs. Gaza children is not only polio what they need. There are many other pressing needs. Therefore, I think we should really collectively push and support this people suffering. I was in Gaza myself, and what I observed, I will not forget it in my whole life. Therefore, I think all of us really have to push continuously for the well-being of these children. At least they should receive really the minimum services what they deserve, starting from sanitary facilities, nutrition, basic nutrition, education. Many of them are separated from their families. I can't finish listing. Therefore, let's push. And this polio opportunity was a lesson. And if we push collectively, there may be really a room also to support these children. I think that is what I would like to say. Thank you so much, and thank you for organizing. And it is the effort of everyone, from advocacy to the local people who facilitated, who mobilized, who vaccinated the children. We are simply presenting two of us. Irfan, I didn't know also you are coming to here, therefore we met here, both of us. But we complemented each other, I hope. Therefore, it was a good opportunity. Thank you so much, and have a good day, have a good evening.
It is so important what you're saying about that. It represents the ability of everyone involved, also Israeli Kogat, that they were able to allow this to happen, to bring about the pause, the medical truce. In this time when nothing else seemed possible, you were able to bring this forward, and therefore anyone who's been involved in that effort, strengthening those voices becomes extremely important. Dr. Irfan, go ahead with your closing statement, if you would.
Yeah, thank you. So just echoing what Asnakew said, but just maybe adding 2-3 more things. One is that we are still not out of woods. Still, we have done 2 rounds, and the quality of the campaigns were good. But we still have to see, and that's why we are saying we have to strengthen surveillance. So we will be looking after, that if there is any virus left. So we would be, planning to do any more responses if we see the virus again. So still, the risk is not all, 100% gone. The second thing is, as Nagu said, there are other plans as well, and I think as a team, we should all work together. I think there is a need for a measles campaign there. For that, also humanitarian pause would be required, and some other interventions, as we were saying, that to strengthen routine immunization. So for all the health interventions, not to say the other things which Snaku mentioned, but all health interventions, they need some pauses to actually allow the healthcare providers to reach out to the communities. So we all have to work together. And the one thing which probably from this Gaza response, that as a team, what UNICEF, WHO, what we learned is that we will apply some of these principles in other countries where we are suffering, like Sudan, like Yemen, like other conflict countries, and we would be reaching out to all partners to ensure that we also reach to the unreached population in those countries as well. So we would be using this Gaza as kind of motivation for us, and also taking some good lessons from the Gaza response and implement it in other countries. So we are very much dependent on all the support from all over, and we will be asking for all the support for us to stop this virus once and for all. So thank you for arranging this, and that's all from my side. Thank you.
Thank you.
Can I just make one last comment that
there are some questions if anyone wants to stay on a little bit longer.
There are a number of organizations that are beginning to mobilize to respond to the fact that the world has failed children, in particular with respect to armed conflict. We have the Geneva Conventions, we have the Convention on the Rights of the Child, we have the optional protocol on children, child soldiers, and so on and so forth. So none of that has worked to address the critical issues impacting children. This is an example of that. But together, we're going to really need to reset and reflect on what we need to be able to protect children, whether it's in Gaza or Yemen or Sudan or in the future. And so there's an opportunity for all of us to work together to really look at how in the future how we protect children who are engaged and are impacted by armed conflict. So Donna mentioned that there were a few questions.
I can.
Please. And somehow your sound isn't on. Oh, you're on mute.
Sorry for that. Sorry, yeah. I think I unmuted and then muted again. So on this question that clean water supplies, I think all the risk factors have been very clearly mentioned to COGAT and partners, that what are the risk factor and what it can spread and how it would be spread. So there, I mean, as Asnakew was saying, there is a lot of needs in Gaza right now. So clean water is one of the challenge that we are facing. But right now we cannot do much. I mean, maybe other partners are doing some activities. UNICEF is also leading on wash activities. But I think there is a big requirement there, which still is unmet. Some of the others, I think, yes, if there are unvaccinated children or maybe adults, they can also, take virus from one place to other. I probably will not answer on any political side, but I mean, these probably the technical side, so I would refrain from responding to others. And thank you for the people who are asking these questions.
I want to mention that about clean water, but also soap, just hand washing soap. The American CDC is very clear that when fighting any type of epidemic, including polio epidemic, washing hands is critical. And there just hasn't been soap available in Gaza for 8-10 months now. Commonly available, people are washing with sand because they're not able to wash with soap. I know that the efforts now are to open the trucks, to begin some form of air bridge with helicopters. This is all very important, and getting hygiene supplies on the ground is just something always to be asking for. Yes, medical supplies, and yes, hygiene supplies, and food, and clean water.
I just will make one comment. I think Asnakew is going to respond to that. Is that for soap you need to have water to wash hands with. I think the first requirement for the community there is clean drinking water. They don't have clean drinking water. Rather, we are talking about washing hands. I think that is something which really is a need, that we need to have clean drinking water for them. But Asnakew, over to you.
Yeah, thank you, Irfan. This hygiene and sanitation is very critical, and the major challenge is frequent evacuation of the people. When they evacuate to one place, they try to establish something to get water source. Of course, there is one water source. I saw many people lining to have water. Therefore, water is a major problem. When they move from one place to the other, frequent evacuation, there is no sanitation facilities where they use, and it is really very challenging. As Irfan said, UNICEF, one of the areas UNICEF trying to support is hygiene and sanitation, but it has not been easy really, because not all trucks available are being entered to Gaza, and there is some also looting. I remember during the vaccination, before the vaccination, soap was included in some of the shipments, but it didn't reach the humanitarian zone after Karam Shalom. There were some lootings, and this is happening again and again. Therefore, really there are a lot of challenges. Otherwise efforts are going on through UNICEF and other humanitarians there to supply also with soap and other hygiene supplies. We tried also to integrate with the polio campaign some hygiene supply kits to be distributed, but we were encouraged actually not to do that. But I think this is the beginning. This is not the end. Therefore, we have to continue really our push, our advocacy, to have other similar humanitarian process, and then such very critical things are really supplied in the future. This is the beginning. It is not the end. Therefore, that is what I would like to say. Thank you so much.
I think you're absolutely right. And one good effect that we saw in the last couple of days was that to the logistics cluster, Israeli regulations have changed. They're now allowing for, without restriction, they're allowing vaccines. So the first time that we've seen that in terms of medicines being provided, at least they're allowing people to apply. But this will not, it's cited without a restriction. And then some aspects of hygiene supplies are being also allowed in without restriction now in the last couple of days. So hopefully we can do exactly what you've suggested. Let's push harder, get this opened more. Make it possible for clean water and food and supplies to get in. Thank you. The under-vaccinated communities, that question is about Orthodox in Israel, and that is an under-vaccinated community. So the government of Israel should be taking this very seriously, as should all governments. There are under-vaccinated pockets, communities in every country in the world. So it's not a question of simply vaccinating in the conflict zones. It really is important that vaccinations for polio continue throughout the world, and certainly there are some remarkable efforts on that education side. I want to always encourage that. We hope to see more of that throughout in the United States as well. Thank you on all of that side of things. I know there was a question about what will be the consequence. Right now, let's keep, we have to do our best to safeguard and feed people and keep them alive. And those questions about consequences will certainly be addressed and are being addressed currently. So thank you very much on all of that. So I think we can close now. And Nisreen, if you would, you can bring forward any closing remarks on your side as well.
I don't have that much more to say, except that it is very critically important that we continue to pay attention to this. We know the polio virus does not respect borders, and with the escalations that we're seeing in the region, there is a subsequent likelihood of virus spread. So it's more important now than ever that we as a global community really dedicate, time and energy to ensuring that children are vaccinated and that the vaccination of children is prioritized. And so for all of those who are in the US, I put the link in the chat. Please continue to contact your elected representatives. They can do a lot in this case. Thank you so much.
Thank you. Thanks, everyone.
Thank you.
Thank you.
I'm so proud to be in your